Eric is 88, and after weeks confined to his room during lockdown, he's thriving on a return to normality. But there are fewer residents in his West Yorkshire care home to enjoy the activities with. Half of the 68 beds are vacant.
So this is one of the empty rooms that we have at the moment. It's been empty 7-8 weeks now.
9 residents passed away in March and April. 2 tested positive for COVID. But that alone doesn't explain the situation. Deaths in the community mean fewer elderly people to admit. There's lower demand for post-hospital care because surgeries have been cancelled, and some relatives are worried about safety.
The inquiries I've had from families wanting, a room for their loved ones, that's the question they ask. Have you had anybody with COVID? Do you have COVID in the home now?
We surveyed care homes to get a snapshot of the situation across England. The 256 providers who gave us full responses have a total of 9,735 beds. In June 2019, 1,281 were empty. In June this year, that number was 2,404. It's almost doubled. The average occupancy rate for the homes we surveyed was 92% last June. It dropped to 81% this year. 15 homes like this one were less than half full in June, and the financial impact is huge. This home is currently losing around £8,000 a week in income, but they've still got most of the same fixed costs. There's a mortgage, a building to run, staff to pay, and for the foreseeable future, extra costs in PPE and cleaning products. They're being pushed to the brink. It's an anxious time for the owner.
Being brutally honest, if things don't improve, then we would have to look at the future of the care home and whether it's financially viable going forward. That would be a last resort. Currently we have 34 people who live here. It's their home. And if we had to make a decision to close, I know I'd be pretty devastated.
60% of the residents here are funded by the local authority. They have increased payments by 10%, but it's not covering the empty beds. The organisation that represents local authorities blames a legacy of underfunding from national government.
The pandemic has absolutely brought it to a knife edge because we were having problems in this sector to start with. The councils have not been given the funding to support social care, adult social care, and in the care home sector. So we can't help them within the councils. But if we had a proper funding mechanism, we'd be able to do that.
There you go.
They have been clear of COVID here for many weeks. They're ready to welcome more residents safely and desperate to keep people like Eric happy in the place they call home. The question is how long they can afford to do so.